afternoon to everyone. I'm Satakshi. Today I will be the host for the panel discussion on the occasion of International Women's Health Week. And I welcome you all to We Talk Do You, a show by Puberty to Menopause, a public health awareness initiative by Human Biological Institute. Now I will now I will be sharing our corporate presentation on healthcare business. It was established by National Dairy Development Board in 1982 as its unit and later registered as a company in 1999 with the name of Indian Immunologicals Limited. HBI was established in year 1998 when the government of India requested IAL to produce a modern tissue culture anti-rabies vaccine to phase out unsafe nerve tissue vaccines. The first manufacturing facility of HBI was established at Ooty. The first facility is one of its kind in India to have rolled out a first varicella culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are in major player of human vaccines. Leader in ARV segment, present in around 60 countries. Three state-of-art and manufacturing facilities at Ooty, Gachibowli and Kargapatla. HBI has forayed in market of clinically proven wellness products and infertility ranges of hormones. Our vision in shaping global healthcare is spreading the One Health initiative, and our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customer needs. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs for flagships of Abyarap and Abyarap PF. As a corporate social responsibility, we have adopted schools where IIL is providing infrastructure and basic facilities, including in helping midday meal program in association with NDDB through our gift milk program. That is, hundreds of school-going children are benefited daily. We have also donated oxygen generation plant to TIMS. These are some information about IIL. For more information, you can also log on to www.indyimmune.com. Please follow us on social media sites LinkedIn, Facebook, Instagram, X. Puberty to Menopause is yet another initiative of HBI where we talk about everything and anything on women's health. Today, we talk Do You? This show is dedicated yet another very important topic and day, that is International Women's Health Day week, a journey through women's health. We would like to welcome our three esteemed doctors for panel discussion with a very short video. Please, please welcome our doctors. We are joined today by Dr. Shivani, a dedicated expert in fetal medicine, FMF certified, and a background in MBBS and DGO. She is currently practices at Shivani Hospital, Ludhiana, where she focuses on advanced prenatal and diagnostics. Next, we have on board is Dr. G. Shweta, a distinguished gynecologist and fertility specialist, holds an MBBS and MS from Gandhi Medical College, Hyderabad, and a DNB from Sir Gangaram Hospital, Delhi. With expertise in laparoscopic surgery, she is currently practices at Lifespan Hospital, GD Metla. We are honored to welcome Dr. JP Moore, MD, DNB, ONG, FICOG, and a highly respected consultant, obstetrician, and gynecologist with a distinguished career spanning clinical excellence, academic mentorship, and a leadership role, including President of Guwahati ONG Society and Treasurer of Northeast ICAR. Dr. Moore brings wealth of knowledge and experience to our today's session. Let's start our show by few common questions on the topic of an International Women's Health Day week, a journey through women's health. Today session will be around puberty and adolescence, pregnancy and maternal health, and menopause and midlife wellness. We are going to start our very first topic and our very first step towards womanhood, that is puberty and adolescence. So my very first question will be with Dr. Shibani. Doctor, what are the earliest signs of puberty in girls and how can parents support them during the transition?
So, puberty itself is a gradual process which starts around somewhere 8 years of age, and the Indian, according to Indian standard times, if we see, so the minimum age is 10 years, the maximum age could be somewhere around 14 years. So, now puberty itself does not only means menarche, which all of us think it to be, as the layman people they think it to be. Puberty is it involves telarchy, which includes the breast developments. It includes the pubarchy, which includes the axillary and the pubic hair development. It includes the growth spurt, which helps in attaining the height, and then comes the menarche, which is the last thing. So this is the gradual process of puberty. And how can the parents help the child? Definitely by giving a good education is very important for the child. It should be aware of what he, or even the he, I am not, it is not only the girls. We usually come to puberty and address only the girls. It is also the male and the female. Both of them are going through a certain change in their life, which involves the physical changes, the social changes, the psychological changes, and the body changes. So parents should be aware of this, and they should counsel their child, and they should talk to their child from the very initial phase for around, I think, from 6 years onwards. Why? Because in males, the adrenarche is the first thing to come, which comes at around 6 years. So that is the time when we should start talking to a child, and then obviously the other platforms, that the social media, we can be more responsible there that way. The health workers. Apart from all that, in the family, the good environmental factor is very important. The father should be very responsible. The parental association is also said to be very responsible for the good pubertal changes.
Well, very well explained, Dr. Shivani. You very well, like very correctly mentioned that we, as a common public, we need to know this question, the answer of the question. You rightly mentioned the parents should educate their children and they should make them feel confident in the change they are making.
Definitely.
In Yeah. So thank you so much for the insightful answer. My next question is with Dr. G. Shweta. How can we address the stigma and myths around menstruation in school and other communities, ma'am?
Yeah, though we are advancing in our education, in our curriculum, there is still a lot of myths and stigma going on, not only in the villages but also in some of the Orthodox families. So the first thing is the parents should take a step ahead even before the child attains a menarche or a puberty biological process. They should have an open discussion in the family Not only the parents, the elders of the family should have a one is to one talk with the child. We have to give them the freedom to address their doubts, whatever they have, and frequent group discussions, like for example, during a parents teacher meet, the parents and the teachers can have a discussion regarding what are the changes going on, so as to remove the myths. As well as you can have some community sessions or counseling sessions, not only for the children but also the parents and grandparents, that it is not something a taboo, and this is not something dirty or which is not to be discussed. It is a biological process, it's a healthy thing going on, and it indicates the child physical as well as mental well-being is good. There is nothing to be shy about that, and nothing to postpone the discussion. So if the parents along with the grandparents, and the child spends most of the time with the teacher or with a peer friends group, so involving all the members together for frequent discussions. And you being a mother or a woman of the family, you should take the lead role to put an example by telling your childhood experiences, or being a doctor, what are the experiences you face with your patients, being a discussion in your family that will help the child to understand that this is a normal process going on. There is nothing to feel shy or not discuss with your colleagues. And you should also encourage your child to have open discussions with a peer group, and let it be either of the students, boys or girls. Co-ed schools also, there are a lot of sessions or classes going on regarding puberty and menstruation, so all
Yes.
the kids are now being aware of that. And such sessions should be going on not only in the schools but in the colleges as well as in the communities. So whatever myths and taboos are there, we can try to avoid them, and inculcate a healthy lifestyle to the children.
Correctly mentioned, ma'am. As you have mentioned, we should inculcate the healthy discussion among the education centers, such as schools and other coaching centers as well. So, very correctly mentioned, ma'am. Thank you so much for that answer. Now, my next question is with Dr. JP Moore. Sir, what is the role of nutrition which plays in healthy adolescence development?
See, nutrition has got a great role, particularly in the developing stage from the teenage to the adulthood, that is the adolescence period. This is the time where the physical growth is occurring. To the maximum, height increases, weight increases, muscle mass increases, bone mass increases. So nutrition has to be a balanced one. So every parent should know what is the balanced diet required for the adolescent child. This nutrition improves the cognitive functions improve, sexual development of the adolescent period occurs in this. Three things are occurring in this period. So if the proper nutrition is given, all the three things will develop in a proper way. Neither the child will be lean and thin or will be fatty. Obese child are nowadays very common. Second thing, their teenage thinking is a very important in the adolescent period. Their cognitive function will be better. They will be asking question answers, and the many things which are occurring with the cognitive function in the adolescent period, that will also not occur if the proper diet is given. And thirdly, the sexual. So when we talk about the diet, what are the diet required? First thing, adolescent period. So what they need, more protein. Protein
Yes.
requirement has to be maintained. When is when the when the person is vegetarian, we have to manage in a vegetarian way. If they are non-vegetarian, the sources of protein are high compared to the vegetarian. So they should know what are the protein sources. Then another most important, the calcium, because that is required for the bone growth and deposition. So calcium intake has to be high. Then the important nutrients, other like iron, that is iron deficiency is very common in the females in India. So proper intake of iron and iron-rich food should be there. Then other minerals has to be there. Healthy fat should be taken. If possible, omega-3 fatty acids should be added in their food for the cognitive function. That is very important. So, and second thing, with the nutrition, proper exercise we should always eat. So that
Yes.
proper exercise, useful utilization of the nutrition will be there. Then the eating habits. Nowadays, adolescent eating habits are very bad. Either they will have a long fasting period or they will eat very frequently. So we should create healthy eating habit. Any sound is coming in between.
Satakshi, can you just mute mine? I think it's from my hotspot.
Yeah, it's coming from your computer, laptop, I suppose.
Can you mute mine, Satakshi?
Yes.
So,
Yes, sir.
eating habits, we see now that the main problem is adolescent obesity is occurring very commonly. That is improper eating habit.
Correct, sir.
So,
Sir, yeah.
yes,
Uh,
please.
sorry for the interruption, but you have
No
rightly
problem.
mentioned that we have to take care of the nutrients, and I would like to make a point here. Like nowadays, there is a point of micro and macro and micronutrients which are required in our daily life. So, sir, what is the role of the parents and educator? Like, uh, how we can educate the child and bring that confidence in taking up those, following up those diets and everything.
See, nowadays adolescents are more interested in the junk food that
Yes,
everybody knows. And over the online junk food is very available and all the children they are interested in that. So
yes,
we should emphasize the macronutrients and micronutrients. So fruits and vegetables, that is a good fiber source and the mineral source is there. We should emphasize and try to prepare a diet where they, if the children are not taking directly fruits and
yes,
vegetables, we can make such a way like soup, we can make vegetable soup, the way we can give. And micronutrients with, there are many sources of micronutrients. Like if the vegetarian diet is there, and if the
yes,
patient and dietary milk and milk products we are taking, then we are also getting back. Milk is a complete food, except
yes,
iron. All the things we are getting, and vitamin D source is required. If the
yes,
non-based source is not there, this milk is a very good source, milk or curd or whatever we say, buttermilk. So
yes,
we should guide the children that their diet should have proper fiber intake so that constipation, other problems will not there. Then metabolic problem which is occurring in the adolescent period nowadays and starting like PCOD and other things, they are also related to the diet. If they
yes,
are taking enough fiber. Second, intake of fluid. Fluid intake has to be very high. Secondly, ours is a tropical country. Even this we are seeing in our daily practice that adolescent girls are coming with UTI
yes,
and they are wearing of the garments. We should guide them properly.
yes,
They should not wear such a tight garment in tropical period that sweating occurs and the fungal infection occurs very commonly. These are
okay,
simple things regarding the daily life. Lifestyle management is guided by the parents only. But the problem is that adolescent thinking and the parent thinking is changing nowadays. And they are always at the crossroads. So that we have to fill up properly with the proper counseling of the child that you should eat this thing. Once in a week you can have junk food, not daily. So
yes, sir.
that minimum amount of injury occurs to the body, not the maximum amount with your junk food eating.
Correctly mentioned, sir. Thank you so much for such a insightful explanation about the nutrients, proteins, calciums, everything. And you rightly mentioned we need to do some counseling of growing child which are in their adolescence phase. Thank you so much for that answer, sir. Now, my next question is with Dr. Shivani. How young girls can be educated about their body image and self-esteem during puberty, ma'am?
Now, see, young girls or the boys, anyone, you cannot miss upon the boys definitely. So, okay,
Yes,
puberty itself involves a lot of things. So, there are many chemical hormonal changes happening in our body, which results in lot of varied looks, facial looks to the girls and the boys, which basically is very important as a external appearance of mine. If I don't look good to myself, my confidence and self-esteem is definitely going to go down. So if I need to look
correct.
presentable in my personal eyes so that I'm a little confident down there. So for that, we need to tell them, we need to sit them down and tell them that it is a normal change happening in our body. The word normal has to be emphasized because today in today's generation, the filter world, they think whatever picture is being put forward of the influencers, of the actors, of the actresses, they look like that. So we want to look like them. So it is not like that basically. So the changes, whatever hormonal changes are happening with us during this time, they are going to give us oily skin, they are going to give us pimples, they are going to give us hairy structure things all over our cheeks, and it might be less for someone's fast, it might be many for someone if there is some metabolic disorder. So this has to be told to them that this is, if it is normal, it is within the normal range, and these are certain changes we are going to observe during 10 years to 13 years of your lifestyle. And this should not put down your self-esteem or the confidence when you look up into the mirror, or even we have gone through this phase, everyone goes through this phase. Being a parent, at least I would tell my son or my known people around me that I need to, again, basic thing is education. We need to tell them that what you see is not the truth. What you see in the mirror, you are seeing is the truth. So this is only because of the normal hormonal changes which is happening in our body. This is called as adrenarchy, which is the first and the initial phase of puberty. So pimples,
Yes.
oily skin, hairy skin, this is absolutely normal, and we should, that should not be the point of concern for your self-esteem and confidence during that age, 10 to 13 or 14 years of age. And then it weans off with time, it weans off, and then we get back dry skin or oily skin, whatever it is, we get back to the normal conditions. So again, the root thing is we have to educate them. We have to tell them this is normal. We have to spend time with them. That is very, very important. Like, I can just give a small example. Whenever a girl walks into my clinic, a 10 years old girl, she is apprehensive more than her mother is apprehensive. मैम बच्चे को बहुत जल्दी periods आ गए, अभी तो 10वां साल लगा है. So we need to counsel the mother as well there. If the mother is not counseled, if the source is not counseled, she cannot tell anything to her child. So I keep the child apart. I first start counseling the mother that this is normal, you need to understand, and then I put the words to the child that, see, if it does not happens, then you are abnormal. You should be happy that these changes are happening in you. So we should use some motivating words like, you should be happy that this is good thing, and if it does not happen, things will go wrong and something. This is what I personally feel and practice. I The rest is, you can also put in your opinions.
Yes, very, very rightly said, Dr. Shivani. And I'm really sure if any adolescent people are watching this live session, must be satisfied and happy with your answer. Thank you so much for it. So, my next question is with Dr. Shweta. What are the common menstrual disorders in teens, ma'am? And when should they seek the medical help?
And that, yes. The
Yes.
common menstrual problems, what we routinely see is, of course, definitely early menarche. Previously, the age of menarche was around 11 to 15 years. Now there's a preset of the menarcheal age. It is around 8 years, 8 to 13 years. The reasons being many among them. So, first most common presentation is early menarche. The child or the girl doesn't even know what is that. Suddenly, one fine day, she sees blood and she's so worried that she can't even discuss with her parents. So, we have to emphasize that age-related changes might occur very early from 8 years onwards. So, from 6 to 7 years, we should be cautious. We should be counseling them. So, most common problems what we see is. Having the child attains around 8 years and she might not have her periods for the next few months, and suddenly she sees a gush of bleed, that's called menorrhagia. So early puberty, having severe menorrhagic cycles with heavy flow or frequent cycles, once in every 15 days or once in every 10 days, until the hypothalamic pituitary ovarian axis is well established, they might have frequent periods. And as sir rightly discussed, because of the food habits, what our we children are now facing, a lot of them have amenorrhea. Like they may not have periods for around 3 to 6 months, and she might have put on lot of weight. And one fine day, the mother and the child comes with heavy menorrhagia, that the baby has severe blood loss and she'll be landing into anemia. So these are the common conditions we usually see with puberty early onset. And the first way to treat that, the first way to detect that is we have to tell the that these are all normal findings. And as soon as she attains her, her health hygiene, what is her menstrual hygiene, we have to counsel her regarding sleep hygiene also, so that she adjusts to all these changes in her body. She maintains a regular timetable for her eating habits, dietary habits, as well as sleeping habits, so that these changes, what we see like heavy flow or no flow, can be either stopped or postponed.
Yes, ma'am. Yes, you have rightly mentioned that we should focus on the hygiene, health and hygiene part of them. The nutrition part also plays a vital role here. So, thank you so much for the answer, ma'am. My next question is with Dr. JP Moore, sir. How can parents and educator create a safe space for conversation about puberty and sexuality?
Can you repeat the question, please, once?
Sir, how parents or any educator can
Uh,
create a healthy space for to have a discussion about puberty and sexuality of adolescent people?
yeah. See, adolescent period, the main development of the secondary sexual characters are occurring in
Yes,
females and males both. So first thing we had been education should be there in the schools itself. Counseling should be there in the schools, so that every school should have a counselor, so that a counselor can guide that these changes are destined to happen in your body. Females are going to develop the breasts properly. They will have their menstruation. Eh, these are the sexual development and sex education in the schools that has become a taboo to talk in the society now in India, but that is very much required. If a girl or a boy knows what is reproduction, what is their physiological function of their organs, and how to take care of the organs and how to avoid sexually transmitted diseases, India becomes much safer in the adolescent period. Second, education starts from the home. The parents are the first teachers. So they have to communicate freely with their words that these are the changes occurring. And it is very difficult for a father or a mother to talk with a girl or a son, boy regarding sex. This is a very big taboo in our society. If you can bring down that taboo and make them understand, see, you are until the age of 21 years, sexual life should not be started in you. But otherwise, having sex, a male with a female, is a normal thing. If this cannot can be explained in a very simple way, so that they can understand without having a taboo, it is always better. Adolescent period is the time many times they get swayed with the friends and other things and they do many wrong things, sexual exploitation and so many things do occur. But if they are guided. Second, this adolescent period girls should know what is the good touch and what is the bad touch. That is required from the very small child itself. But again, they should realize that the boys having friends is good, boys and girls and everything. But when you come close to somebody with bodily touch and nothing, you should have a limitation. That explanation has to come from the parents itself, teachers itself, counselors itself. So, regarding the education, regarding the body's self esteem, and avoiding sexual violence, it is no more important that boys should also learn because the violence is created by male to the female. So, if the male is groomed properly, the violence will not occur. So, we should groom the males also. That
correct.
it is not that thing that a female is a thing to use. They are equal to you. They have equal rights to you. They have got right for their body also. It is not that you can do anything to their body. As you have got right for your body and everything, your protection, your sexual desire, your sexual feeling, they have also equal rights. So this education, if it goes from the community, from the school or colleges, from the parent side, from the elders, this will go a long way to make them understand what is sexology and what is
Correct.
required, what is not required in this age group.
Yes, right, rightly said, sir. Very right. You are I agree with you on this point that still a taboo in our country to discuss on puberty and sexuality, but we need to break this taboo and we need to discuss more on this openly so that our adolescent public might be more educated with the facts and figures like India is facing right now. Thank you so much for that answer. My next question is with Dr. Shivani. What mental health challenge are common during adolescence and how they can be addressed?
Again, the same thing. Addressing has to be done by proper education. And the what are the mental the things which we go through are basically anxiety, depression. Now there are many emerging studies which have noticed that there are certain brain developmental changes which happen during puberty, and they have made some evidences also with the CT scan reports and all that. So they have said that there are certain cellular changes which is happening in the brain during puberty, and a part of it is hippocampus, which is somewhere related to our psychiatric illness and depression and anxiety. So that correlates that yes, our mental health is somewhere, sorry, brain development is related to puberty, and our mental health awareness also is related to that. Now, again, how can we address it? Is, as I said, education is again very important. We need to tell them that depression, anxiety might happen, but as sir also rightly said, and ma'am also rightly said, that we see all of us are talking only about education. So we need to talk. The most important thing is we need to talk to our child. We need to create awareness in the public, not only with our child. Even if we go to schools now, the teachers, the blackboards, the soft boards, they have certain messages always regarding all of this somewhere down the line. So I think addressing and talking to our kids and the social at the social platform also, like we are doing one today, is also very very important, so that they know what is normal, what where we can seek help, when it is the right time to see the doctor. So if there is depression part is hanging it is important for them to either go to a psychologist or go to a psychiatrist, or there are even health coaches nowadays who can just they give very good behavior cognitive therapies. That this behavior cognitive therapy is just talking session. So all that can be taken care of when we are talking about the mental health of a growing child.
Yes, very correct. Very correctly mentioned that we need to
Can I
develop
add
the
one thing here? Dr. Shivani has very rightly said, very good explanations he has given.
yes,
Just
sir.
one thing I want to add: the environment at home,
Ah,
environment around,
very
and
nice.
Yes.
environment at the workplace. All these things are also counted in this anxiety, depression, substance abuse, all these things. In what conditions the
Definitely, sir.
child is growing up, that is very
Yes.
important.
Yes, yes, agreed to you, sir, on this point. We need to create a comfortable environment at home and at education center as well, where they
Yes.
can openly discuss and talk about it. Thank you so much, Dr. Shivani and Dr. Moore, sir, for more insightful answer. My next question is with Dr. Shweta. How important is HPV vaccination during adolescence, and what should parents know about it?
Yeah, HPV vaccine, human papilloma virus vaccine, is now in. It is in the Indian vaccination schedule itself. It is actually now many of the parents as well as the students are also getting enlightened about that. It is recommended around 9 to 14 years of age group for both the girls as well as the boys. It is actually it is a vaccine to prevent this virus called human papilloma virus. And if you give at that particular age, even before the child attains puberty, the efficacy or the effectiveness of the vaccine lasts long. And ideally it should be given around 9 to 14 as a two dose schedule at 0 and 6 months. And but if the child is not vaccinated or the parent comes after 14 years of age, she can get it done until 25 years before the first sexual exposure. However, the dosing of the vaccine will be three doses at 0, 1, and 6 months. But according to the studies going on, you can give the vaccine until 45 years of age if the woman is not having any active pelvic inflammatory disease or getting a pap smear done. And the majority of the girl child mothers are getting it vaccinated the daughter and the mother are coming for vaccination, what we have to emphasize is even the boys require the vaccination, because the virus is the one which, it is also transmitted from the male genital tract. So once the vaccine is given at the correct age of 9 to 14 years, the prevalence of the cervical cancer, not only cervical cancer but also the cervicitis, vaginitis, or anal warts, or anal cancers, as well as the oropharyngeal cancers, the incidence can be drastically brought down. And it is now being inculcated through sessions in the schools or in the colleges. And now we are being displayed at the hospital centers also about the importance of vaccine. And many of the people are now coming forth by themselves, either through Google or through social media. I heard about this vaccine, madam. Can you further explain me in detail? How does it benefit my daughter? She has taken only one dose. When is the next dose? So they're coming as groups. So we have to emphasize the importance yet again. And yeah, it is going on now.
Yes, I've read somewhere that 80% of the cervical cancers could be cured. How much you are agreed with this fact, ma'am?
Yeah, definitely.
With HPV vaccination.
This is the only vaccine available for a cancer. As such, no cancer is having a vaccine. Definitely, studies are there in the US that it is. See, of course, US breast cancer is the most common compared to cervical cancer. India, it was the cervical cancer which was standing at the number one position. The incidence has definitely decreased, probably because of the decrease in sexually transmitted diseases. The incidence is definitely decreased. There are studies in the US as well as through UK based studies. The efficacy of the vaccine is really good, and the incidence of carcinoma cervix is actually coming down in India, because it has started for the past 15 to 20 years. The efficacy of active diseases is coming down. So definitely, because it is a slow growing virus which has a long latency, we have to follow up the patient for a quite long time. And it is definitely improving. 80% is probably not the exact number we can say, but the incidence from CA cervix being the first disease, now the incidence is definitely coming down.
Great. Thank you so much for such an insightful explanation, ma'am. Thank you so much. My next question is with Dr. JP Moore. Sir, how can digital media or peer pressure impact the adolescent health, and what can be done to mitigate it?
This is a most difficult question at this moment. See, digital media has got more negative impact than the positive impact on adolescent health. See, digital media is a very good thing. So many things adolescents can learn from the digital media, but it has been under the peers' guidance. If you make, if you give a mobile phone to the class 9, 10 child and you are not monitoring the child, so the moment you type the X word, everything goes in the pornography. So that thing has to be controlled. See, they have got a very fragile mind, power, and they can easily sway to the wrong. So that peer guidance has to be required, whether you are giving laptop to the child to use adolescent period, whether they are using mobile phone. Even they know more than their parents about the mobile phone use. Even you give the lock, they can open. So this is the, and it is always better they don't do use the mobile phone or laptop in the a lonely place. In the presence of parents, open area, if they are doing, they will not never do any wrong things. So this is digital media. So many good things are there. Value-based education, what they are learning in the school, syllabus-based education can be converted into value-based education in the digital media with good examples and the stories and everything added there with the experiments. So provided they use this media properly for their development, they can use it. And second thing, the mental disturbance, depression, sadness, suicidal tendency is again a big cause through the digital media. These games which are coming in this media, parents, peers, teachers, elders in the house, they should take care that they are not going through these types of games. So many suicides has happened in the past by playing all these games. So If we are not taking care and keeping an eye on the adolescent child, they can go in a wrong way very badly. That is very
Yes.
important. Time. You should
Yes.
give them freedom, but a limitation has to be there at some point of time.
Yes, you're right, sir. We need to be vigilant on what child is watching, and we need to be more cautious about what they are scrolling on their day-to-day life.
Yeah,
Very
yeah, yeah.
rightly said, sir.
It is very important.
Correct. So now we are moving towards our next topic, as it is International Women's Health Day. Now we are going to discuss the most vital phase of womanhood, that is pregnancy and maternal health. So my next question will be with Dr. Shivani. Ma'am, what are the most important health checks and screen during pregnancy?
So, the health checkups during a pregnancy encompasses many things. It is first is obviously antenatal checkup, which they have to do regularly, which in the initial phase has to be probably once a month, and then it becomes twice a week, and then it becomes weekly by the end. So this is a general pregnancy checkup, and then there are certain blood investigations which are important, so that we know when you are entering the pregnancy, your body is supportive of that. You are not entering pregnancy with anemia. You're not entering pregnancy with infection. You're not entering pregnancy with certain other illnesses. So this is the first basic thing which has to be done. Then with pregnancy, you have other certain investigations. There are many of them like sugar monitorings and the dual markers and many genetic things. We should not be discussing that. That is not important at that this point of time. What is important is antenatal checkups for during the pregnancy, blood investigations, the diet which the patient is being offered or she is vouching in for, and mental health again is very important. The exercise she is taking care of, and again the other cognitive therapies that she is going around with. And apart from that, very important is sleep has to be adequate, rest has to be adequate. So this encompasses many things. There is just not one thing we can say that 9 months of pregnancy is just the visit to the doctor. It will encompass the doctor, the family, and her basic behavioral input also.
Okay, rightly said, ma'am. We should take care on maternal diagnosis and what are some other things. We have a couple of comments on in the chat box. Someone has asked doctor how to prevent cyclic mastalgia in women.
Cyclic what?
Mastalgia.
Mastalgia.
It is
Nostalgia.
nostalgia.
Yes, nostalgia in women.
How to prevent?
Cyclic nostalgia in women.
See, now
Mastalgia.
cyclical mastalgia cannot basically that can this is hormonal changes which is happening during this. We are not talking about pregnancy now. Now this yeah, more important. Usually, girls, females are presenting during the periods time for this. This is again a hormonal input which happens, and it can happen premenstrual, which happens probably 10 to 14 days, which in the luteal phase of the cycle, patients will usually come with breast tenderness, and that only stays for certain point of time. It is again not all throughout the cycle of menstrual period it will stay, and it usually comes down by its own. But there's yes, vitamin E has played certain amount of supportive role. There's nothing we can give as a treatment for it. Supportive treatments are definitely available, but then you need to understand as a patient it is supportive treatment. uh, it is not the treatment. Sir and ma'am can put in some.
Can I tell something?
Yes, yes, sir.
Yes, sir,
Like
please.
cyclic nostalgia, as Dr. Shivani has very rightly said, this is the hormonal changes which are occurring. We have to understand the same hormone is occurring on the affecting the breast and same hormone is affecting the uterus. So it's very common that where those girls who are having dysmenorrhea along with that cyclic nostalgia is also time at the period. But if the cyclic nostalgia lasts for a very long time, 10 to 14 days before the period, then we have to think that whether it is a case of endometriosis or not.
Hmm.
Endometriosis, it is very common that breast is affected for a long time. and cyclic nostalgia is there for a long time. And even if you do feel the breast, you will feel the gritty feeling in the breast, which is not actually the solid mass is there, but the feeling is that way. So these type of women may respond with simple vitamin E treatment we are giving, and if it is very severe, we can give Danazol here. That improves the thing. Or if you are
Yes.
trying to control the cycle by oral contraceptive, the both things come down.
Basically,
Okay.
I think I would say one thing. They should know that if it is not a longer period of time, matlab, it will be
Yeah,
fine. But
you are very
as
right.
sir said, that if it is lasting for a longer period of time, it's better they visit their doctor.
Yes,
Yeah.
correctly mentioned. If it is extending for a longer period of time, we should definitely consult the doctor. And we have other question of the chat box. I'm reading out to you, doctor. How to tackle hot flashes during menopause?
We'll anyways come to that, no?
We are coming
Sorry.
to that in the next.
We are
Yes,
coming to
yes.
the next topic.
We are coming to the third section, and then we will ask you the question related to menopause. It will
Yeah.
work. So my next question is with Dr. Shweta. How can expectant mothers manage stress and anxiety during pregnancy?
Yeah, once the woman is pregnant, definitely there'll be a lot of issues going in her mind regarding how she'll maintain her family, how she'll take care of her baby, what will be the postpartum status. So, in the very first antenatal visit itself, what I usually suggest is for the expectant mothers is they should have a routine management of their weight, routine management of their family issues, as well as stress and sleep. If she's able to balance all these things along with her regular antenatal checkups, usually she can maintain her stress levels at a lower pace. Most important among this is you have to tell the mother as soon as she comes in the first visit that her body mass index, check her weight, check her height, and give her a target of weight. She should not go into excess of weight gain, or she should not have less weight gain in a pregnancy. Ideally, it is around 10 kgs if the woman is a normal BMI. If she's very lean, she can go until 13 to 14 kgs, or if she's obese or if she's a diabetic mother, around 6 to 8 kgs. Because gaining more weight or not gaining weight is the first thing about stress, not only of the mother as well as the family members. So you have to address her about the weight issues. She, however, will be having regular antenatal checkups, but you have to insist on her on having, at least a basic walk of about 15 to 20 minutes in the early morning sunlight before she has a breakfast, or regular stretching exercises, and most important, deep breathing exercises. They release lot of positive hormones, endorphins, which cause a positive effect on her mind, as well as carries the pregnancy more safely forward. And always I insist the pregnant woman and her family to come together for a counseling session or for antenatal visits. Most of the working women, they just come back from their office, or while returning they come for a checkup. I will always ask either your husband or your mother or mother-in-law, somebody should assist you, so that she can share whatever problem she has with her family members, and we can address their family members so that they can support her. And we should always give importance to whatever minimal complaint the mother is addressing, and we should not ignore things and say, no, this is all hormonal changes, it is all normal in pregnancy. You have to address her that you, whatever complaint she is giving, you, the husband at the first stage, as well as the in-laws or parents, they should take a step forward to at least hear her problem, to understand her problem, and tell whether it's normal or not, and not to just ignore the things. And this is chalo मैंने pregnancy में भी ऐसा देखा, it is not normal, don't, you're stressing it a lot, this is completely normal. So you should give a positive attention to whatever the mother says. And suppose she's having a regular blood pressures and regular sugars and everything being monitored, a night walk of around 10 to 15 minutes also after dinner will help to have a positive influence on her body. And these stress levels can be managed basically with family support, as well as having her good amount of physical activity, And she also can attend, antenatal yoga classes or prenatal classes, and she can join any online, sessions where she can be registered with other pregnant women, so that they have a common discussion platform going on. Whether she has some doubts, she can share with her colleagues or in those platforms, and believe that these things are all normal, nothing is there to worry about. And probably these all things put together will definitely help her reduce her stress levels.
Yes. How wonderfully you have explained the physical activity importance and the support of family members. You have very well explained, ma'am. We have a question from the chat box. Which vaccines are recommended during pregnancy?
Yeah, actually, pregnancy, it's live attenuated vaccines are recommended. We usually follow 2 doses of tetanus toxoid, TT vaccine around 16 weeks being the first dose. The second dose, we give a Tdap around 28 weeks. Flu vaccine is also can be given around 28 to 32 weeks. Apart from these additional vaccines, if the woman is having some, risk factors at home, she can get those vaccinated. Now, previously, we were having even these COVID vaccines going on, and basically these two vaccines are recommended.
Okay, okay. Thank you so much for the answer, ma'am. My next question is with Dr. JP Moore. Sir, what are the key components of a healthy pregnancy diets?
As I have said before regarding the adolescents,
Yes,
it is all the same plus extra calories required for the development of the baby.
yes.
So
So
it
there's
has
one
to be,
question. Yes,
yes,
sir.
please. Yes, yes. What is the question?
No, sorry, sir. You were
Yeah.
saying something.
I was telling that a balanced diet is very important.
Yes,
See, first trimester of pregnancy, diet is very difficult situation like nausea, vomiting, giddiness, not feeling well. So, as a gynecologist obstetrician, we never emphasize on diet on the first trimester. I always tell the patient, eat something at least. Don't remain empty stomach. So that some nutrition you will get. But after 12 weeks, when the nausea, vomiting, other things come down, we emphasize more on the diet and the weight gain. Because these 6 months, I tell the patient average 2 kg weight gain has to be there. So 10 to 12 kg weight gain we can expect for the average woman. So to increase that weight, we need extra calories.
yes,
So extra calories in the form of carbohydrate required, fat required, and protein requirement is more, because protein is more important for the development of the muscle and mass and everything in the baby. So again, that has to be balanced with the vegetarian and non-vegetarian people.
yes,
Then diet in some societies are very difficult, like even they are taking protein in high amount, they are getting denatured protein like fried things they eat. They are frying the fish, they are frying the egg, they are frying this thing. So we have to emphasize upon that you are taking too much of denatured protein, it is not working in your body. Rather you take a healthy protein, you take boiled egg rather than taking an omelette. You can boil the fish and take, rather you take this milk and curd, as I have told you, these are very good things as a protein source. Lactalbumin you will get. Then second comes the fiber part is very important in pregnancy. Most of the women, because of the progesterone effect, they will complain of constipation. So high fiber in diet is very, very important. Fruits, vegetables, green vegetables. Thirdly, as I've said, in adolescent period, fluid intake has to be very high. Otherwise, same UTI is very common in pregnancy, and it is very difficult for the gynecologist to treat that UTI.
yes,
But that goes in recurrent UTI. So if the fluid intake is very high, UTI chances are very less comparatively. Second, the vitamins is required, minerals are required. So one thing is very essential that every woman has to take the iron.
yes,
Iron she has to take. Second, if her food contains enough amount of calcium, she may not take extra calcium. That is not always calcium is required. And this protein food available in the market, I never say to the patient to take. You should try natural protein. That is the best way. Don't waste money on these things. These are all consumer products shown in the social media and other places. And secondly, healthy diet, a healthy thinking, and healthy lifestyle. Positive thinking is very important. And frequency of diet. Three major meals and three minor meals is very important in the pregnancy period. Not like only three meals we are taking, and not like 10 to 12 meals. They can take 10 to 12, but at least three major and three minor meals is required, because the stomach emptying time is increased. So if you take too much meal at a time, they will feel bloating, and all these problems will come. Rather, you take frequently and less amount of the meals so that you can digest properly. You take certain things that can be digested easily. So nutrition, important part is the good amount of protein, healthy fat. If the patient can afford, he can go dry fruits. He can go for, that is a good
Yes.
source of vitamin B12 and other things. If
Yes.
she is non-veg, she can take non-vegetarian food. But don't take the non-vegetarian food in such a way that it is not digested. It is causing indigestion in you. So that
Yes,
is very.
you have rightly mentioned that we need to move towards the natural proteins, and you have already mentioned about the diets we need to follow. So there is a question from the chat box that now PCOD and hormonal imbalances are very common. So how to handle this, and what is the correlation between the pregnancy and that PCOD?
See, PCOD is increasing in the society. Even 20 to 30% girls are suffering, and they start from the adolescent period itself. And this is a lifestyle related disease causing metabolic changes in the body. So when there are three factors are management: their diet, their exercise, and their stress. High stress in them is creating problem. Lack of exercise and physical activity creating problem, and lack of improper diet they are taking, that is creating problem. So if you want to improve PCOD, medication is not important. Important is that you improve your lifestyle, improve your positive thinking. That will help you. So yoga is there, other exercise is there, free hand exercise is there. That you, and as you are asking about pregnancy, in PCOD, pregnant naturally or by assisted reproductive technology, in both the cases it is found that miscarriage risk is high compared to other people, because already hormonal changes are occurring there. So sustaining pregnancy in PCOD is a very important factor. If the concerned gynecologist or physician knows that this case is PCOD and she has become pregnant, so proper guidance and proper supportive therapy is very important. Otherwise, miscarriage is very common. Then these women in the later part they develop gestational diabetes very commonly, because the PCOD itself, as we know, the insulin resistance is already there. And nowadays we are preferring, if the patient is taking metformin for PCOD before the pregnancy, she should continue this metformin during pregnancy also, so that insulin resistance doesn't occur in her. So we have to be very observant regarding this patient by OGCT, oral glucose challenge test we call it, to see that they are going towards gestational diabetes or not. Secondly, PCOD are mostly obese patients are there. Infection risks are very high, their immunity is low. So we have to be very careful while treating this patient regarding the diet. As the madam, Dr. Sweta has very rightly said, the exercise is very important. That walking, I always say that walking and free hand exercise, they should do at least 20 minutes a day. If we are doing 20 minutes brisk walking, that is more than enough in pregnancy to avoid the preeclampsia or pregnancy-induced hypertension, gestational diabetes. All these things will go.
Yes.
And good
Yes.
sleep. That is a very important factor is there.
Yes. Very
I would
rightly mentioned, sir.
Yeah.
Yes, ma'am.
I would like to add on something to this. See, once we see a adolescent girl or reproductive woman with PCOD, majority of the changes are already done. So what I would insist is all the mothers of the family should take a measure. At least physical activity should be a part of their curriculum of the child. If the child goes to school daily, it's a part of her curriculum. Daily she gets up, she goes to school. So before she goes to school, even though she is not having any complaints, even though she looks healthy, she eats well, she sleeps well, we should make a practice to make all the girl childs to have at least 200 skippings per day before she goes to her school, so that she doesn't land into PCOD, or she can postpone the changes of PCOD. Because by the time we see a girl child coming to a clinic, it is half of the problem is already there. So then onwards, if we start doing working or exercise, she might not have much result. So we should inculcate like our school education. This should be a part of a lifestyle that should be taught first to the parents. Or majority of the parents like, my daughter is all fine. Why should she do exercise? She is very busy studying. She has no time to do exercise. If she has no time to do exercise, then she has to face all these issues in the future. The mother should be educated first. Mother and the family members. Thank you.
Yes, rightly mentioned, ma'am. Thank you so much, sir and ma'am. I hope the person who has asked the question might have got the correct and accurate, authentic answers. Thank you so much for the answering this question. And my next question is with Dr. Shibani. How we can ensure safe and respectful maternal care in both urban and rural area. And again, ma'am, we have a question in the chat box that how menstrual health and hygiene could be ensured in natural disaster affected areas.
So we answer the first one first.
Yes, please.
What was it? Could you come back to the question so that the first question is pregnancy related?
How we can ensure the safe and respectful maternal care in both urban and rural settings.
In both urban and rural. See, urban is at this point of time, urban is not much of a problem because you are getting good maternal health care, you are getting good child health care, you have the neonatologist there. There is no transportation problem. You have the accessibility to postpartum care also, post delivery care also, and the caretakers are also around. And most important is the people around you are comparatively educated and they know the pros and the cons. If we come to the rural area, the problem is basically socio-economical background. They do not have enough funds to reach the proper place of delivery or to reach to the hospital. They don't have trained skilled workers, maybe the obstetricians or the neonatologists at the particular place wherever the delivery is happening at that point of time, or they are getting it conducted with. Then the transportation is a problem if it is a very far off place. The rural area basically is suffering because of socio-economic backgrounds and the myths around the pregnancy which they carry, where they don't want to make a proper attempt for the antenatal checkups, where they don't want to make proper attempts towards the ultrasounds, which are the basic requirements of the pregnancy, and then the postpartum care. For them, pregnancy is only getting pregnant and delivering after 9 months. So the other parameter is not coming into the play. So that I think needs to be addressed where they need to be. See, we cannot handle the economic standard. We cannot sit and talk about the economic conditions which they are going through, and we cannot make a solution to that. What we can do sitting here is at least educate them and tell them the pros and the cons associated if they don't show up early to the doctor for their pregnancy. We should very carefully tell them if they become pregnant at the early age. They become pregnant at 18 and 19 years of age. Then again, it is an high risk pregnancy because again, it is associated with certain other illnesses like preeclampsia, most commonly. Other hand, on the urban side, where pregnancy is happening on the later age group, 37, 35, 48 years of age group. There, the problem is again diabetes and other PCOD to the child also. Again, we are talking about that. So this is the major problem which I think it towards the urban and the rural area is. And I think education again, may it be through the doctors, may it be through the social workers or the leaders, it might help. The second question
Yes, ma'am.
was.
Someone in the chat box has questioned how menstrual health and hygiene could be ensured in natural disaster affected areas.
Oh, that's a very difficult question. I feel, matlab, how this natural disasters area first. We really don't know what disaster is happening, which kind, which level
Any
of.
disaster like a landslide could be
That's
there,
what.
flood
What
could be there.
level of disaster is it? It is not always a landslide. It can be a very bad landslide. It can be a very bad earthquake where everything is being distorted and everything. at that particular where it is very badly hit. Like for example, we can talk about the Indian standard, which happened in Badrinath in
Yes,
5, 7, 10 years back. If we talk about that 1 week of time, all the shops were shut, nothing was available for them. All they could have done is, and it was raining again, exposure to all kind of infection is there. All they could have done is, any other menstruating girl is, the basic menstrual hygiene is cleanliness of the perineal area, or any dry clean. Using the word cloth is a wrong thing, but in that kind of a situation where you are stuck, you are left with no other help, then you have to basically take care of the cleanliness of your perineal hygiene and the stuff you are using as a pad, because we are not accessible to menstrual cups there, we are not accessible to tampoons there, we are not accessible to sanitary pads there. So what you will be accessible to, you'll be accessible to at least a clean dry cloth. Even if it is not clean, you should have, if there is some facility available to make it clean, boil it, dye it, or whatever you can do by your this thing, or a simple cloth would help. But then it has to be your perennial hygiene and frequent changing of that cloth in that natural disaster. If it is a small landslide, you're going to Shimla now, there is a landslide, you can easily get your stuff, and then you can, whatever basically we follow, we can do that, I think.
yes, yes.
May
You have
I add one
rightly.
more thing here?
Yes, sir.
She has very rightly said, in disaster condition, whatever is available, you can use it, clean it. The most important problem is the disposal of that thing.
Yes, sir. So,
Correct.
yeah.
Disposal of that used product. Like in the military operations, the females, what they are doing? They are in the jungle, or the places where they cannot. So you should use a plastic bag with the jeep or something, whatever is available, and
Mm.
in closed space you keep it, so that if there is flood everywhere, it is not getting spilled in the
Yes,
water.
yes, yes.
If so, this disposal part is very important.
Correct.
Okay,
Correct,
thank
sir.
you.
Thank you so much for giving us this rightly said answer of yours, that we need to, firstly, we need to sanitize whatever we are having, even if that is a cloth, we need to sanitize and use in that natural disaster condition. And secondly, we need to dispose it in a very correct way, so that it should not put a burden on the social thing. So, thank you so much, Dr. Shivani and Dr. JP Moore, for answering this question. My next question is with Dr. Shweta. What are the warning signs and complications during pregnancy that could not be ignored?
Yeah, coming to the warning signs are or dangerous signs, you can say, of pregnancy. The woman should be educated that during her 9 months of pregnancy, she can have those signs anytime. The first 3 months, most commonly we see is, having any excessive blood loss. Like usually, spotting in early pregnancy is normal, but if she is facing severe crampy pain with excessive blood loss, it might be a sign of, threatened abortion, and she should be aware of that this is a serious condition. Second, the woman might experience severe weakness because of, hemoglobin percentage being dropped less than 7 grams, irrespective of whether she's bleeding or not, because anemia is still rampant in our country, and the women conceive very early in their teens. So anything hemoglobin less than 7 grams, and she experiencing shortness of breath, or difficulty in performing her routine household activities, or swelling of the face and legs immediately when she gets up in the morning, is also a danger sign. In the mid 3 months of pregnancy, many of the working women, or because of, urbanization, we see a lot of women suffering with high blood pressures called preeclampsia. So severe headache during pregnancy, or weight gain more than 2.5 kg per month, is also indication that she is landing into high blood pressures. And even single recording of blood pressure more than 140/90, the women and the family should be, made conscious that that is not normal. She might have high chances of getting high blood pressures, and she should report immediately to the doctor or to the, medical center whenever she has severe headache with vomitings, or blurring of vision, or a severe right hypochondrial pain, right hypochondriac pain, or decreased movements, and unexplained excessive bleeding or presence of blood in urine. These are all the warning signs in the, around 20 weeks to delivery. And even sometimes many of the women, because of PCOD or because of urbanization, are landing now into gestational diabetes, as well as that might continue to diabetes also. So any unexplained severe weight gain, or high blood sugars, on oral glucose tolerance test, or a random blood sugar more than 126, it is a sign that she's landing into diabetes, or she's already into the stage of diabetes. And we should explain the signs of severe blood sugars, like sudden giddiness or blackouts, or loss of consciousness, or absent of baby movements. These all indicates the sugars are on a higher side. And apart from these disorders which we commonly see, we should also think about other medical disorders, like cardiac diseases are also being increased in pregnancy, probably because of increasing maternal age, or pre-existing conditions like high blood pressures and diabetes. Many women are also facing cardiac disorders. The woman might experience unexplained chest pain, or shortness of breath, or something heavy in her chest. Whenever she is having such symptoms, she should approach the medical faculty immediately. And whenever we see a woman with any of these signs, we should always explain her that she should have a attendant or a family member by her side, and she should not travel alone, or she should not, you know majority of the working women are driving vehicles. She should not drive her vehicles. And yeah, and she should have regular antenatal checkups. Apart from the routine checkups, these women with high risk factors, they should have an additional antenatal checkups once they are detected anything significant in their routine examination.
Correct. Thank you so much, ma'am. As you have rightly said, that we need to take care of our weight. We need to take care while driving, while doing any work. These are the some very important feedback of yours. If some mother has conceived, she should take care on the pointers which you have mentioned right now. Thank you so much. We have a question from the chat box, ma'am. That is it safe to take HPV vaccination during pregnancy?
The safety of HPV during pregnancy is, as far as my knowledge, is not yet proven. She can take it. She can take it in the preconceptional period, definitely not during pregnancy, and in the lactation immediately after delivery, probably 48 hours later itself, she can take the HPV vaccine. But as far as the Indian studies are there, the safety and efficacy in pregnancy is not yet proven.
Okay. Thank you so
All
much for
live
that.
vaccines in pregnancy are avoided.
Yes,
Okay.
yes, sir. Correct.
Yes.
SPG is a live vaccine, so if she has taken a single dose before the pregnancy and
Yes.
she could not take the second dose, then what we say that let the pregnancy be over, lactational period, she can take the second and third dose. But during
Yes.
pregnancy, we are not giving nowadays.
Yes. Correct. I hope someone who has asked the question might have got the answer. Thank you so much for answering that, sir and ma'am. My next question is with you, sir. How does maternal mental health impact both mother and the baby?
See, we are getting this type of problem very commonly now because of the mental stress of the working woman, and they are under stress for the 9 months that they will rear up the baby, because the child in the mother itself says that I am a child now, how can I rear up another child? This sort of thinking comes in that. So when the mother is anxious too much, anxiety, depression, all these things are there in the mother, she finds in a very difficult situation after the delivery to get attached with the baby properly. So attachment of the mother and baby is affected in those conditions when mother is having psychological problems. Whether it is a full-fledged psychological problem like schizophrenia or other things, or it, so initially they find difficult in the breastfeeding itself. See, breast milk secretion is again related to the brain conditions. So they find difficult for the breast secretion, breast suckling, breastfeeding to the baby. Second, taking care, rearing of the baby, taking care of the sanitary changes in the baby. So the attachment of the mother and baby is badly affected if there are psychological problems in the mother. And at the same time, if there are psychological problems are with the husband and wife, that is creating psychological problem in the mother. So from the very beginning, the baby is affected. The mother, because of her problems, she is not eating properly, her health will be affected. She may become anemic, she may become muscle deficient, cachexia, or she may eat too much to divert her depression with the food. She may become too much obese. Sometimes the women they complain that I have delivered by cesarean, I become obese. There the question of their psychological status also comes. And second, the baby when they don't rear up very properly, they are taking care, their vaccination, their pediatric checkup, their proper treatment, proper feeding. So baby also becomes irritable like the mother. Even the neonatologists they say that this is the psychological condition around you which is creating environment. So this is very important that mental status of the mother has to be maintained in the satiety stage, happy stage, so that baby can be reared up in a healthy way.
Correctly mentioned, sir. You have rightly said that the health of the child is linked with the psychological state of the mother and the father as well. So there should be good relation be maintained between mother and her husband as well. Thank you so much for answering the question, sir. We have next question. Um, what are the benefits and challenges of natural birth versus C-section, Dr. Shweta? I think we have lost Dr. Shivani in between.
So, what are the advantages of a normal vaginal delivery
Yes, and C-section.
versus C-section? Yeah. Now, as the decades are going on, it is always a normal vaginal delivery always takes the upper hand compared to a C-section, and but the scenario probably now is on towards increase in the rate of C-section, and when the mother is having no risk factors, risk factors in the sense of her age, her medical disorders, or her stature. Pertain to all these factors, if she is having no medical disorders and that the child is doing absolutely fine, there is no growth retardation or there is no development delay or there's no oligohydramnios, always natural birth delivery plays an upper hand compared to C-section. And the recovery of the mother when undergone a natural delivery is always far much better than C-section. Her blood loss, her postpartum early recovery levels, she having her breast milk expulsion for the fetus is always on a higher hand, and her stress levels are definitely less. Family support requirement is also comparatively less in compared to C-section. And the cesarean section now is probably on an increased trend because definitely increase in the maternal age factor, maternal medical disorders. Now we are seeing more cases of high blood pressures, more cases of uncontrolled diabetes, all these causing, either growth restricted babies or severe oligohydramnios. And then C-section for the benefit of the mother as well as the baby, we have to plan for a C-section. But coming to the discussion, as always, the natural delivery is preferred compared to C-section, and we can't pertain it on a general bias basis like that. It depends on individual case, and the individual case we cannot extrapolate it to the whole community as such.
Yes, correctly mentioned, ma'am. Thank you so much. Now, I have a question that how we can improve the awareness and access to prenatal and postnatal care in underserved communities, sir. This question is for you, sir.
Like awareness you are talking about,
Yes,
no?
yes, yes, in
See,
underserved society and reason.
underserved society, first we have to know what is underserved society. These are the marginalized people in the urban area, like cities, and the rural areas.
Yes,
These are the societies where the so it has to be a multi through the government side, through the basic health worker side, through the NGOs. That is, government is also trying from the ASAs they have created, so that no home delivery should occur, that every delivery should occur in the hospital. So if we train the ASAs basic guidance for counseling the women regarding the antenatal diet, antenatal exercises, antenatal bed signs, risk signs, and the postnatal after the delivery, how to take care of the baby, why the vaccinations are important because there is a taboo regarding vaccination in certain societies, and they should guide that natural food how to give to the baby up to 3 months, 4 months onward, how to add the solid food, semi-solid food. So these the ground level workers has to be guided properly by the upper level, and then they will pass this knowledge to the urban level and marginalized people. Secondly, we can have mobile vans with the doctors, with the counselors. We can go to the villages and guide the people regarding antenatal checkup, importance of antenatal checkup, antenatal guidance, hospital-based delivery. All these things are important.
Yes.
Secondly, government is providing iron, calcium, vaccines, everything to the society. But whether they are reaching at the grassroots level or not, that's the grassroots level you are talking about. They are reaching to the slum people or not. That we have to see, observe. So here the role of NGOs also come. There are so many NGOs in our country, Lions, Rotaries, and all these things. Some women's organization. They can go to this grassroots level and find out that whether antenatal, neonatal babies, postnatally mother, they are getting care or not. Second, postnatal guidance to these people regarding the contraception is very important because abortion rate is highest in these marginalized people. Unwanted pregnancy is more in them. So government hospitals, so they are putting property in them, but there is a lot of taboo regarding property in the lower classes and illiterate people. They think that copper tea is not good for health. Copper tea is bad for health. That is creating infection. That awareness has to be there for the postnatal period for the woman. Then they should be guided regarding the conjugal life if we are not giving the intrauterine devices, how to use the barrier method, how to use the other methods, contraceptive pills. So unwanted pregnancy has to be avoided in the postnatal period after the delivery after 1.5 months. And early postnatal period, care regarding the episiotomy wound, if it is done in the hospital, infection rate is very high. Then again, the most important part comes the nutrition in the postnatal period. Antenatal, they were eating properly. Then postnatally, they forget that we have to eat high protein diet and other things. Whereas that postnatal period, they need more food, more diet, more protein than the antenatal period because the nursing of the baby is totally from the mother. So these guidelines through the community, through the health workers, through the doctors, through the NGO, through the government that is required.
Yes, sir. Thank you so much for such a elaborative answer, sir. As you have rightly mentioned, we should take care the women who are going through that phase should take care of her postnatal and neonatal both with the eating habits and taking care of her nutrients and everything. Thank you so much for the answer. We have a question that the sanitary pads that we're getting in the market, are they safe?
Most of the sanitary pads which are available in the market, they are very safe. But we should always see that they are coming from the standard companies or not. Because the main part is the sterilization part of that. Otherwise, you can take any garment also. What is the
Yes,
difference? Sanitary
correct.
pad has to be properly sanitized. It has to be sterilized.
Yes.
And that if you take from a standard company, I think that is correct. And Dr. Shivani wanted to say something regarding that. She can say.
No, so you came down to the same point, right?
So thank you so much, sir. As we have limitation of time, we are moving towards our next topic of the day, that is menopause and midlife wellness. So my next question is with Dr. Shivani, that what are the most common symptoms of menopause and how can they be managed?
The most common symptoms of menopause is definitely irregular cycles, which any female will start experiencing. It will be either usually it is delayed cycle or at times it might be frequent cycle. It is related to her menstrual periods, with the timing of that. That is the most common thing. Then comes the vasomotor symptoms, which is the most commonest of all and which bothers everyone. That includes the hot flushes, the night sweats usually the females feel, and then irritability. This is another thing. Then comes the urinary problems. That includes the urinary incontinence part. Will genitourinary problems usually patient will start feeling. Then comes the sleep disorder. Usually, at certain point of time, the sleep patterns are also deranged. Then is the vaginal dryness. Usually, the vaginal area is usually moist. And with time, as due to lack of hormones, sex steroid hormones, the dryness comes into play, which causes dyspareunia, that is painful coitus. Then comes the mood changes. Mood changes again, irritability, anxiety, depression. These are the varied symptoms. The most common and most fearful for any female is hot flushes. That is
Yes.
the vasomotor, the
Yes.
vasomotor things.
So we have a question related to hot flash itself in the chat box. Yes, doctor, how to tackle hot flashes during menopause?
See, hot flushes can be every female usually experiences hot flushes. It can be mild to a very severe form of hot flushes. Mild hot flushes or any kind of vasomotor things or the menopausal symptoms can be taken care of by small little things like avoiding caffeine, doing a layering of dresses so that you know you can de-dress yourself after you have worn 2 3 layers of dresses. You can carry a portable fan. You can use an ice this thing to pout down your face into. Then comes your isoflavins, which your doctors prescribe, which we use during the perimenopausal or the menopausal age people. And if isoflavins do not work, then the last resort is the hormonal replacement therapy. Now, again, for isoflavins and the hormone replacement, you cannot do it yourself because there are many factors involved, especially in the hormone replacement therapy. You have to visit your of a gynecologist and then we can prescribe. There are varied forms, there are many contraindications associated with it, and there are many different forms of things available. It is available in cream, oral form, patches form. For different symptoms, different sources are available. So you have to visit your gynecologist for that.
Great, great. You have that area of expertise, and you have answered that question very wisely and very good, smartly, ma'am.
Thanks.
So now I would like to move towards the next question: that how does menopause affect the mental health, and what support is available? This question is for Dr. Shweta.
Yeah, what the symptoms we see in the perimenopause and menopausal age group are mood swings, especially because estrogen has a very important role in your brain. There's a part called hippocampus and hypothalamus where it has a mood activating center. Because these estrogen levels are all deprived in our menopause, there are sudden changes not only in this woman who is undergoing menopause, but also when we remove the uterus. Sudden hysterectomy also causes these changes. The mood swings, anxiety, irritability, depression, and most common things we see usually these. And the woman, she doesn't usually share, she doesn't know herself that she's in a state of depression, anxiety. It is the opposite person or the family member who actually identifies these things that she's going through. And whenever we see certain changes like that, we should try to address it at the earliest. And usually we advise the woman who is having such symptoms, like they come and share, I'm not able to share those things at my family, or I'm not able to discuss those things in my family. We should first advise them to have, as discussed, basic exercise or yoga or training sessions first, to have a positive attitude or a positive behavior in their lifestyle. Still she's not comfortable, she should have a group to share her feelings, like in the same menopausal group, or a friend or somebody who can understand those issues. Still she's having those issues, she requires a counseling, that this is a normal part of physiology every woman goes through. And suppose she's still not able to maintain, we have certain medications available. She can go for ssris or anti-anxiety, antidepressant drugs, and she has to be maintained. Because if we are not giving those drugs, the woman will face these symptoms to a higher level, that she goes into severe depression, that nobody is able to pull her out. So identification at the earliest stage, trying to rectify it at the earliest stage with basic measures. Still if we are not able to doing, we definitely have to go on for add-on therapy with medication. It can be either hormone replacement therapy if she's not having medical disorders or other comorbidities, or you can also go with anti-anxiety or antidepressant drugs.
Okay. Thank you so much for such an insightful explanation, which women go through. And Thank you so much for elaborating on points that again and again you are elaborating on the point that we need to exercise, we need to do some kind of medication to make ourselves calm, because women are mostly run by the hormones, and if hormones are working correctly, we need to be, very productive in our day to day life. Then we need to take care of our body through yoga, exercise, and few other mental activities we need to indulge in. Thank you so much for that explanation, ma'am. My next question is with Dr. GP Moore. Sir, how can women differentiate between normal aging symptoms that require medical attention?
In menopause,
Yes.
would you please repeat the question? What are the
Sir, how can women differentiate between normal aging and symptoms that require the medical attention? So
okay.
nowadays women are very much confused that it's a normal aging, but they might need some kind of medical attention while they're aging. They might be facing some symptoms
See,
while they're aging. Yes.
whatever Dr. Swetha has explained regarding the
Yes.
when they are exaggerated in any
Yes.
way, Dr.
Yes.
Shivani has also said, like hot flushes. See, when hot flushes become so excessive that is affecting her lifestyle, her daily day-to-day life, and she cannot control it by her lifestyle changes, then medical attention is required in the form of hormone replacement therapy, or we can go for nowadays Ayurvedic products like cohos, isoflavones, she has said, or sometimes counseling also works that this is a natural way. Physiological changes occurring, you have to accept every woman goes through. And it has been found that lean and thin women they suffer more with the hot flushes and other things compared to the obese women. Eh, so that we have to guide them there regarding the diet, regarding the exercise. Second thing, if a woman has had menopause for say 1 year or 2 years, and she had bleeding after that, she's having bleeding. So any post-menopausal bleeding should not be ignored, and that has to be consulted with a doctor. Investigation has to be done until it is proved to be normal. Normally, also sometimes sudden ovulation may this thing occur triggered. Menstruation can occur, but we have to find in our medical practice we always think that it has to be considered as a cancer until proved none. Thirdly, if there is excessive white discharge after the menopause, normally vagina is dry, urogenital area is dry, white discharge and other things are not occurring. But the woman is having discharge from the vagina after the menopause that goes in favor of cancer of the cervix. We should never ignore it. Foul discharge, foul smelling discharge. The problem with the aging women in our country is that they never that complain of anything. They do not want to go to the doctor. They don't want internal examination. We are not having screening for the cervical cancer regularly by pap smear like Western countries. That is why we are detecting cancer in the second stage, third stage. And then any medical disorders may be related to that thing. As they have said regarding the heart problems, kidney problem, any other problem which may occur in menopause, we have to go for the doctor. But related to menopause, one thing is these hot flushes, then osteoporotic changes, they may need this thing. The thinning out of the bone occurs after the menopause. Easy fracture can occur in the vertebral bone, hip fracture, and other fractures. So, if there is any pain is there, too much muscle pain is there, too much back pain is there, they should consult a doctor that thinning of bone and osteoporotic changes are occurring in that. Then cardiovascular changes again comes here. Because of the menopause, there is no difference between a male and female regarding cardiovascular after the menopause because estrogen has been protecting the female. That protection is gone. So if there is changes in the lipid profile is there, high triglyceride is there, they should also, if you are doing a routine examination and found that high triglyceride, cholesterol is high, LDL is high, then we should always consult a doctor.
Yes.
Then if there is a palpitation, there is difficulty in the breathing, very sudden chest pain, this may be the medical disorders not related to the menopause itself, but it can occur to anyone. They should consult a doctor.
Yes, sir.
So these are common things a menopause woman. Then, as the cognitive things normally occur, she will complain that she is forgetful now. She cannot remember the thing. She becomes irritable little bit because of the hormonal changes. She uh, she feels that she is and having no self-esteem. People are not giving respect to her. The children are not hearing to her. She is not important at home. She is useless. So when it has become excessive in their mind, then they need counseling or psychotherapy or cognitive therapy. These things may be required.
Correct, rightly mentioned, sir. And if women is going through any such symptoms, they should not hesitate to take a psychotherapy or counseling. They should come and they should take the therapy upfrontly.
And one more common thing I forgot about the recurrent UTI in
Yes.
menopause. Urinary tract infection is very common in because of the dryness of the vagina. And second is the dyspareunia. Sexual problem is very common. So that has to be
Yes,
guided.
sir. Thank you so much, sir, for such an insightful answer. We have a question that up to how many years calcium tablets can be taken by a woman of 50 years of age? What is the ideal dose?
May I?
Up to how many years calcium? No, I think the
Ah,
person
that
is
I
going.
understood.
Yes.
Now, I understood. I just asked me. See, calcium can be taken for long time. There are varied varieties of salt of calcium which is available. Calcium carbonate, citrate malate, aspartate, and all those. They are varied variety. What a common man needs to know is if they are prone for any stone formation, gallstones, kidney stone, they have to avoid calcium carbonate. Otherwise, rest other things. Usually, when the doctor prescribes, we ask for certain things and then we prescribe for a longer time. What see, calcium is one of the main component of a healthy diet in a menopausal lady. So it has to be taken for a lifelong. Normally, it should be taken for approximately dose is I think important. 1,000 to 1,500 is a required dosage. During lactation, also this much is important, and during pregnancy, we make it approximately 500 to 1,000. It can be taken for a long time, approximately I think 3 years, 4 years. Also, what I personally tell my patient is take for some 3, 4, 6 months, and then drop it down for 1 or 2 months, and then again restart it. Calcium taking for long time is not important, but what salt you are taking is very, very important. So I think you can get in touch with your doctor and they can help you with that.
Yes.
And
Thank you so much.
I would
Yes.
like to add on that all these menopausal women, it's ideally it's beneficial for them to undergo this BMD and DEXA scanning to know the
Yes,
osteoporosis they have. And it is not only calcium alone which is required; they might require phosphate therapy
other
also.
minerals, yes.
Yes. How long do they continue? Because even if she's taking more calcium, there's no phosphate. She is prone for having,
Hmm.
osteopenia and bone fractures. So this should be
Don't touch it.
inculcated in the menopausal screening as well, along with routine
Mhm.
mammogram and
So
pap smear.
when
She can have
we
a scan too.
Hmm. So, like any doctor, when we menopausal lady enters, we usually tell them a yearly checkup. There are n number of checkup which we ask them to do. So, in that, serum calcium levels and the BMI, DEXA scan, whatever ma'am is telling, is important. We ask them to get it done, so that we know how the bone health is, and then likewise, wise we can prescribe them.
Okay, okay. Thank you so much for the question. My next question is with Dr. Shweta. That what are the risks of hormone replacement therapy and who should consider it?
Yeah, hormone replacement therapy is ideally you can give estrogen alone, which is the major hormone. And suppose she's having her uterus, you can give estrogen as well as progesterone. So, hormone replacement therapy is usually not recommended for all, as we discussed. If the patient is having severe vasomotor symptoms, or severe menopausal symptoms that she requires medical attention, then it is usually given. And women who are having no risk factors, like no cardiac diseases, cardiovascular diseases, risk of blood clotting mechanisms, thrombosis, or these are the candidates, or brain clots basically. These candidates are not ideal for hormone replacement therapy. And if whenever we give a woman on hormone replacement therapy, she should be under constant supervision. It can be either in the form of oral tablets or injectables can be given, but constant supervision. Like if she is having a uterus, she should have yearly once her pelvic scan to see the endometrial thickness, how is it going on. She should have a basic follow up with her breast also, because whatever hormones are given, it will act on her bone, it will act on her uterus as well as breast. If she is able to be under constant supervision with no other comorbidities, then hormone replacement therapy should be fine. Or because medical disorders play a more loss to the women compared to hormone replacement therapy.
Yes, thank you so much for answering this question correctly, ma'am. Now we have that limitation of time. We have already extended the timeline for the day. So my last question is with Dr. JP Moore. Sir, how can women maintain a positive body image and self-confidence during midlife?
This is a very important question. Like proper counseling of the woman is more important. Proper knowledge. I always say menopause, me no pause. I am not going to stop. Menopause is just change over time. That your reproductive life is over. Your headache of menstruation is over. Now you are a free woman. So she should accept this aging process gracefully. That I am more mature now. I should have more self esteem now. It is not my looks that is important. It is my action that is important. It is my knowledge which I have gathered in the years that is important. Eh, So she had to change her attitude towards her body, towards her activities, towards her positive thinking. That what I have gained in the years, I have become mother, I have become grandmother, I have achieved so many things, I have achieved so many things in my productivity, I have got so much knowledge. My looks, my little wrinkles are not going to affect me. Eh, I am looking better than before. So this attitude, if she changes, menopause is or aging or any time in the life, she will not be affected. And second thing, counseling to the lady females in the perimenopausal age group and menopausal age group, that changeover period, mood instability, irritability, memory, as all these signs related to this, if they are if they have the knowledge of the problem, you feel less. Even they get the hot flushes, they will feel less. But if they get suddenly, they get scared. What is happening with my body? But if you know that this is expected, this is going to happen. If you are taking injection, little pain will occur. If you look at that side, you will not get pain. But if you look other side, you will get more pain. That is a thing. If you counsel the women properly, if they have the proper knowledge of the menopause, if they know that aging gracefully is a very good thing, that white hairs is not important. Importance is that what you have gained with your white hairs, what you have achieved in your life with your white hairs, then she will definitely accept, self-esteem will come in her.
And
Great.
one more thing, yeah, yeah. All women, what I feel, irrespective of these three phases, should have respect, self-respect, of course, respect from the others. They should have their consent, and they should have their safety. These three
Mm.
parameters play a major role, irrespective of whether she is menopausal, premenopausal. If she is having these positive three attitudes for herself, we have to forget what is the opposite person thinking. She has to have a positive self-respect. She has to give consent for opposite person to even talk, or at least give a opinion about her and her safety. These three matters a lot.
Yes, correctly mentioned, ma'am. What a wonderful explanation with Dr. JP Moore and Dr. Shweta has given. Thank you so much, sir and ma'am, for explaining and making our women more feel more empowered. Because as sir has mentioned, that gray hairs, that wrinkles is just a explanation that what you have achieved in your life. So it's a very
Totally.
good. We have one more question in the chat box. That is it advisable to use Western menstrual products like tampons and menstrual cups?
Like tampons, I think we are not in use now, and it's not at all as advisable for tampons. Menstrual cups are in vogue now, and it is advisable even adolescents from reproductive age group. menopause, around perimenopause, everybody can use, and those are actually doing quite well. There is no contraindication that's a Western product. We have Indian products too, and it is safety is also established. Comfort, safety, hygiene, all are being maintained with menstrual cups. Tampons, as it's a big no, I guess.
Okay, thank you so much for answering the question. Now we are at the closing of the session. It was a great panel discussion, and as we conclude today's inspiring panel, I want to thank each of you, our speakers, our audiences, our healthcare community, for showing up, speaking up, and standing up for women's health. We have explored the signs and the silent struggles that too often go unheard, from reproductive health to mental well being. Today's discussion reminded us that women's health is not a niche topic, it's a foundation for thriving families, communities, and future. So let's carry this energy beyond this week. Let's continue to challenge the gaps, amplify the voices, prioritize the care and women deserve, and not just during Women's Health Week, but every day. Thank you for being part of the movement together. We are not just raising awareness, we are raising the standard. Thank you so much for our esteemed doctors, delegates for joining us, and audiences for like asking so much of questions and making the session so interactive. Thank you so much.
Thank you, everyone. Thank you very much.
Thank you,
Thank
sir.
you very much, all my colleagues.
Thank you, sir. Thank you,
Thank you
ma'am.
to
Thank you, sir. Thank you,
Sakshi
ma'am.
for
Section here.
conducting so nicely
Yes, sir.
everything and complimenting in a very nice way. You have very efficiently worked, Sakshi. I must appreciate your job.
Thank you so much.
And,
Thank you so much,
and,
sir.
and I
I'm
must
glad.
I express my good wishes to all the women of the world, including my colleagues who are sitting here,
No.
that they have got the right to their body,
Yes,
right to their
thanks.
desires. And we have solidarity for that.
Thank
We
you.
are with you.
We are
Thank you.
Thank
fortunate
you,
to
sir.
have you, sir, on this platform, on this Women's Health Week. Thank you so much, sir, for taking
Thank
part in this panel discussion.
you.
Thank you.
Thank you. It's my
Yeah.
pleasure, really. Thank you. Thank you.
Thank you and bye.
Thank you.
Bye.
Thank you. Thank you.